when you're going to take intraoral pictures of your patient, what you want to consider is how big their mouth is and what's going to be comfortable for you. She's more comfortable with this, but you can get a better picture, a wider picture with the other. Don't hesitate to try the other one because it's not as uncomfortable as you think. Is that uncomfortable for you?
No, that's fine.
See, sometimes we anticipate patients to hurt from different things, but it's not as bad as you think. You can try it on yourself to test your comfort level as well. I like to start off with the one that's head on. You want to place it like this. I like to place it and then have the patient go ahead and hold it. First, I instruct the patient on how to hold it. So I give them examples of, she's doing a perfect job holding it. Sometimes patients hold all the way back like this, and sometimes their lip will go upward and cover the lower teeth. So you want to let them know to relax it here, point it nice and flat, because sometimes patients do tip them backwards like this, and that hurts them more when it's not quite necessary. This is sufficient. I like to give them an example of nice and flat this way. And as you can see top and bottom. Then for contamination purposes, you would unglove. And as if the patient needs any assistance, you can just guide their hands again so you don't contaminate them. I also like to let the patients know, hey, just so I don't touch something that's gonna go in your mouth, I'm gonna have you touch it the whole time. I might assist you with your hand this way or this way and kind of guide you that way. Then when you take the picture, you want to imagine that there's a little T right in the center going through their midline and the flat occlusion, and then just take it head on. Then you focus. Notice this would only get canine to canine. You want to make sure that you're far out enough to get some premolars, some molars. Everybody's teeth are slightly different. You don't want to go at this angle where you see all these molars and premolars on this right side of the patient, but nothing on the left. Can you see that on my screen?
Mm-hmm.
All right, so you want to go right there. Imagine that T. And you can see an equal amount of, let me show you the image, an equal amount of premolars, molars. This was actually almost perfect. Two premolars, part of the molar, okay? That's your goal for the front facing ones. So now with these, I want you to slightly relax this one towards the midline. And with this one, just press it up against your ear nice and tight. Don't pull super, super hard. And for this one, you want to make sure that you get the bite so you can see the relation. If you want to come around this way, so you can see how much overjet they have. Imagine the cross in the middle of the screen going in the middle of, I was gonna say 3 and 4, but that's ortho numbers, the canine and the premolar, just right there. Ooh. Okay, just like that. Then you can see how much overjet they have. Same with the other. We're just gonna switch over. Remember to relax this one towards the midline, and then just push up against your cheek and pull back. I like to describe to push up against the cheek, pull back, versus just pulling, because that creates unnecessary tension, and a lot of the times then you can't get an accurate picture. Again, going between the canine and the premolar as best as you can. So to take full upper arch, what you want to do is you want to describe to the patient to hold them up like a smiley face and open at the same time. Tip your head back as much as you can. And what your goal is to get the incisal edge of those upper teeth. And you also want to have those molars, an equal amount of molars, open as wide as you can. Sometimes you can aid yourself with mirrors to get the full image. And again, you want to have an equal amount of teeth just at the same level. The premolar next to the premolar, the molar to the molar. If you have a nice straight arch like that, you'll be able to see it. Now for the lower, you'll want them to hold it like a frowny face, and you'll tip your chin down to your chest and open as big as you can. And for this one, you want to make sure that you get those molars again. Let's let that focus, and let's see. Just like that. You can see how this one was just a little off because this molar is in full view while this one gets almost cut off. So not everything's gonna be perfect, but you try to aim for perfection. So for our neurodiverse patients who might not be able to tolerate these cheek retractors as much or simultaneously and have both sides be pulled at once, we can just do one side at a time. This will have to be a two-person job. It's a lot easier for one person to hold the cheek retractor while the other one shoots and aims, because you might not want to be in there for too long, disturb the patient for a long time, and then lose their willingness to work with you. So go ahead and try this side. And since the movement is limited, you'll just have to shoot. And notice how I shot right when she was gonna bite down so that I get the full picture. I just it's all about timing, getting the right time, and you can try again. If you don't get it the first time, don't be hesitant to try one more time. If the patient can absolutely not stand the cheek retractor, something that you can try is your own fingers, and be careful not to put it in between the patient's teeth because they could bite you. So let's try that again.
So with your finger going down, so I'm just gonna hold your hand here. Okay. When you retract, you're just gonna go like, try to hold this down.
Like a fish hook, like this.
And then you can like fish hook me up there.
Okay, cool.
You won't hurt your patients. Like I said, sometimes you'll feel like you're gonna hurt your patients. Try it on yourself so you can get comfortable to the amount of pressure that you're using, because this will be necessary once in a while. And remember to stay away from the occlusal of the teeth. So go ahead and pull just a little bit more. Communicate with that second person who's helping you, and snap whenever you can. Like I said, it's all about timing. If you don't get a good picture, then you could always try for another, depending on the patient's willingness or the level of patience. If you've been working on it for a while, they might not let you, but don't hesitate to try again next time. You can also use a mirror. So go ahead and do it with a mirror, retract like you would for the dentist, Kenzie. Ooh, that was blurry. Let's try one more time. Ooh, one more time. Open just a little bit bigger. Brooke, open. And Kinsey, would you mind retracting just a little bit? Let's try the upper. Notice how we partially got that one. You might have to do one quadrant at a time, which is something we typically do a lot. You might have a lot of success with a toothbrush because our patients are used to getting their teeth brushed every morning. So they're familiar with the object. They will let their caretakers brush their teeth. So this is a really good option as well. This is something we had success with one of our patients who otherwise wouldn't have let us take any images because she was really hesitant about treatment. You can use the head of the brush to initiate as if you're brushing, and I'll have you scoot that way just a little. And go ahead and mimic the motion you would of brushing. Notice how I still got a picture that was decent enough to see all those surfaces right here. And then we'll just move across using the head of the toothbrush as a retractor instrument. Another option too is using your phone on live mode. iPhones have this feature because if the patient is moving a lot like we did previously, you can just capture just the right spot on your picture and save that spot. I will demonstrate that. Go ahead and use either of the instruments that you want to use on that. Go ahead, Kinsey. And another nice thing is they might be familiar with the way that people take pictures of them. They might think that, hey, we're just gonna take some selfies.
Because you can actually go into the edit function of it, and when you go into the edit function, you push this and you can scroll through and pick whichever photo is the best, and then when you do that you can crop it and then edit and then crop and then whoop,
and zoom in as well, like that.
That's cool.
and there are teeth.